Aluvia is a medication that comes in tablet form. Its active substances are lopinavir and ritonavir. Aluvia is classified as a protease inhibitor and is used in the treatment of HIV infection. Indications: Aluvia tablets are indicated for the treatment of human immunodeficiency virus infection in adults and children aged 14 days and older. It is used in combination with other antiretroviral medications as part of HIV therapy. How to use: Aluvia tablets are meant to be taken orally with food to enhance absorption. The dosage of Aluvia and the combination of other retroviral medications will be determined by a healthcare provider based on factors such as your viral load, CD4 cell count, and previous treatment history. The typical adult dosage is 2 tablets twice daily. For pediatric patients, the dosage is based on body weight and will be determined by the healthcare provider. Contraindications: Don't use Aluvia tablets if you are allergic to lopinavir, ritonavir, or any of the ingredients in the tablets. You are taking medications that have contraindications or significant interactions with lopinavir or ritonavir. Consult your doctor. Precautions: Take Aluvia tablets exactly as prescribed by a healthcare provider. Do not change the dosage or stop taking the medication without consulting a doctor. Store Aluvia tablets at room temperature, away from moisture and heat. Don't crush, chew, or break the tablets. Swallow them whole with water. Side effects: Common side effects of Aluvia tablets may include, but are not limited to, nausea, diarrhea, vomiting, abdominal pain, fatigue. Less common but potentially serious side effects may include liver problems. Symptoms may include yellowing of the skin or eyes, dark urine, abdominal pain. Pancreatitis. Symptoms may include severe abdominal pain, nausea, vomiting. Changes in blood sugar levels. It's important to discuss potential side effects with your healthcare provider and seek medical attention if you experience any unusual or severe symptoms.